circulation internally, and that really goes a long way to preventing that roller coaster.
Yeah.
Yeah, and it's
So
only 5 minutes, Kurt. You know, could be so much worse.
Yeah.
Yeah.
And I'm sorry, your name again?
Cheryl.
All right, Cheryl.
Mm-hmm.
Yeah. So 5 minutes in the morning,
Mm-hmm.
and I know that Michael really has his hands full with getting you ready for, for day program, and so it's really hard for him to add in something else in your morning routine. So this is going to need to be something where you take the initiative, where he doesn't have to supervise you in the car because he's driving, right?
Yeah.
So you need to be able to maybe set an alarm on your phone or something as a reminder, but to make this a part of, I get in the car, and I tell Michael, I'm going to do my relaxation stuff now.
Yeah.
And you can even, we'll make copies of this for you, this really looks good. And you can go through it. You could even make your own checklist if you wanted to from this. And just go through it and start and work on it on the way. It's something that would not have to be audible. So, it's like tapping might be distracting to the driver. But if you were doing this and doing it on your own, then you would arrive at day program
Super chill.
so relaxed. Do you remember my story about my work and my lunch hours? And
Yeah.
I had a really, 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 really tough boss. And when I first went into her department, she had 10 people. HR was transferring people out of her department one after the other till it got down to her and me. And Dad bought me a gym membership downtown. It was in the big downtown bank. And I would come back from that workout.
Think I could do anything for 4 more hours.
Yeah, well, and I remember one day when she was my desk was in several in front of hers, several empty ones between us.
Yeah.
And she was just at me. I mean, she was just picking away. She was trying to rile me up. And I spun around in my chair and I looked at her and I said, Jane, just keep going. It's okay, because there is nothing you're going to say to me today that's going to get me upset. And her eyes got really big. And she stood up and she walked back out of the room and she came back in and she was fine.
Great.
And I got my work done.
Yeah, there you go.
And I said it nice. Not nice, but I was just kind of laughing about the whole situation.
This is how it is.
And that's how you'd go into today program. You go into day program, people start the drama and you say, whatever.
Yeah.
You guys have a good time.
Yeah.
Well, Kurt, do you have questions for me or things I can answer?
How long have you been in the field?
Oof, that's a great question. In the field, I think I graduated from graduate school or my fellowship 20 years ago. And I've been working here in our chronic pain clinic. We started it, and it's been probably 15 years.
Yeah, okay.
Yeah. It's weird, but I love talking about pain. People look at me cross-eyed when I say that, but it just, it's one of those things that people don't normally understand or talk about.
Yeah.
But affects so many people in so many ways. And so I think it's awesome to help someone feel a little bit more comfortable.
Yeah, I have a friend that has both narcolepsy and cataplexy.
That's a doozy, huh?
Yeah, he's got both of them together.
Yeah, that's a lot, for sure.
He's even gone out on me when he's been doing my massage. He's my massage
And he
therapist.
just drops.
Seneca.
Yeah, I believe it, for sure.
Yeah, he's a former Army Ranger.
Wow.
And
Hung
had
jumper twice, which is probably where he got
Could
the.
severe injuries. Yeah.
Could
Yeah.
be.
Well, I kind of building on that. First of all, I have to say that I know it's hard getting a new department started and everything, but man, I wish that they had told us, him connected with you 15 years ago.
I hear ya.
But now that he is transitioning, we're working with Dr. Floyd
Okay.
to start getting a team built over at university.
Oh, cool.
Is there anyone over there that you would recommend as far as a good person for him to see?
Oof. Off the top of my head, unfortunately, no, but I could do some digging.
That would be great.
Yep.
That would be great.
Gotta find my notes. Yep. Absolutely. Adult
know that part of that, maybe one of the people that she recommended, which was Dr. Jessica Sanders, I believe.
Okay.
But I don't know, she's not directly in pain management, it's in another area, but.
I think she may be in their spinal rehab, which does do a lot of overlap with pain, so
We're
if
seeing
that's...
Dr. Bear there,
Okay.
but not until, that's one of our problems with right now is that
Everything's hurry up and wait.
we don't get an appointment with her to even for a initial consult until July 28th. But we're working on that. Dr. Aaron here this morning is working on trying to get Kurt a scheduled daily medication for his dystonia.
Cool.
Which will take out a huge portion of his pain.
Okay.
If we can just get that settled down.
Yeah.
So that will hopefully get us through till, I would expect that if we see her for consult on July 28th, it won't be until end of August, 1st of September, if we are able to do Botox in that area for him with his shunt.
Yeah.
And that would be probably, we're looking at 3 to 3.5, 4 months before we can actually start Botox.
Yeah.
And then we have the issue that Botox is only supposed to be done every 6 months, and we know from experience with his leg, where we had it done in his leg, that it wears off before the 6 months, so we need an interim plan.
Yeah.
So, but we can do that, but this is such a huge component for you, Kurt, just absolutely huge, this mind and how the brain, that's really interesting as far as the
really silly to talk about, but people forget our brains and our bodies are connected, you know?
Yeah.
And they are, and it can be used in a really great way.
Yeah, and some people, there's a total disconnect there.
100%. And those people, honestly, sometimes end up feeling even worse because they don't recognize how everything goes together.
Yeah.
And the more you realize, oh my gosh, every part of me affects every other part of me, the more we can do to help ourselves.
Yeah.
Yeah.
And by total disconnect, I mean they're totally off their rocker.
Uh-oh. That's not great. That's not great. Well, what is, do you guys have a plan for this stay, or what, just because I have an outpatient that I need to run and see, I'm happy to come back and talk more, but I don't know what your plan is, if you'll be here, or...
We had asked for discharge later on today.
Okay.
We definitely could wait to see the place that we're trying to get to is we have a hard-won appointment with a new psychiatrist tomorrow morning at 10.
Yeah.
So we'd like to be out sometime later today.
Okay.
So that'd be great.
I am fairly confident that my 3 o'clock canceled, so I don't know if that's too long. I do have a 1 o'clock and a 2 o'clock, but I'm happy to come back at 3 and chat for a little bit longer.
Let's plan on that.
Okay.
Absolutely.
Okay.
And I'm making a note. How are things now? I would like to make a note to mention to neurosurgery how helpful this was.
Oh, good.
And how helpful
Thank
it would have
you.
been to hear it 15 years ago. And that because so many of the kids, well, so many people with hydrocephalus have chronic pain, have chronic headaches. We see, we're on Facebook, we communicate with thousands of people that are dealing with this problem where people are not listening to them about how much they hurt because they're not seeing it on the MRI.
I know.
And to be connected with someone like you would just be so
Honestly,
life-changing.
Chronic pain is the most infuriating disease because it's invisible. And unfortunately, it's by definition a disease of our central nervous system, so it doesn't show up anywhere. It's cortical connections, it's our sympathetic nervous system, and you don't see that on scans.
Right.
And so that's why, unfortunately, I mean, the first thing that I remember Kurt saying was, it's annoying when people say it's all in my head. 85% of the patients that I meet have been told that, which just makes me want to rip my hair out. But I wish there was a lot more discussion of it. Absolutely.
Well, and taking care of this side of it, this interaction of it, doesn't make the pain go away if it is something that is shunt related and needs to be taken care of. It's not going to make it disappear.
Right.
But
and I feel like to that extent, people are blowing me off.
But here's the thing, you can feel better by managing this. It's not going to, what I'm saying, it's not like possibly some kind of medications, it's not going to mask it. You don't have to worry about it masking it.
No. So here's, again, Kurt, my brain works in weird metaphors. So this is how I think of things, but I think of chronic pain or chronic headaches like a TV show that's always going on in your head, right? It's just constantly going. and emotions and stress and frustration, it's like the volume dial. So you turn up your emotions and the volume of that TV show, the pain gets way loud. But you turn it down and the pain gets better. You can't turn it off or on, but you can either dial down or up the volume of that pain.
Yeah.
So,
Well, we'll look forward to
yeah,
continuing
sorry,
this
you
at
have to
3.
run, but yeah, I'll be back.
No, you.
Thank you guys, it's nice to
You.
meet you.